Thank you to Scientific Committee to invite me, and thank you attending here to improve the kangaroo care. First of all, this is my first lecture in English, so I apologize in advance. So I'm beginning to share with you early kangaroo care in preterm infant under 28 week, lateral position versus prone position, Kangulat study. I declare no conflict of interest, and the protocol of this study was published in a few months ago, and the trial was registration in the website clinical.gov. The question that this study came from were, is safety kangaroo care on infant under 28 weeks gestational in the first days of life? Are there any alternative posture from prone kangaroo care to decrease the risk of intraventricular hemorrhage on extremely preterm infant on their first days of life? And do the infant need postural change during kangaroo care? It's knowledge that the extremely preterm infant can be greater risk of ABH, especially on first 72 hours of life. The risk of blending is inversely related to gestational age. It may be true that the placing the head in lateral position can compress the internal jugular vein and can be related with poorer cerebral vascular flow and causing a temporary increase in intracranial pressure. In this recent systematic review by LAIA, was published incidence of ABH, of any ABH under 28 week, about 34%, and severe ABH in under 28 at 15%. The alternative posture of prone we found was in the evidence this study by Boyle in 2016. In this study, they put the baby in kangaroo care but in flexion position. But in this study, saw only communication or mother depression. So the general objective is evaluate the equivalence or non-inferiority at lateral kangaroo care position versus prone position in the axillary temperature stability on preterm infant under 28 during their first 5 days of life. The specific objectives are to describe safety in early kangaroo care on preterm infant under 28 postmenstrual week and to compare the number of ABH cases related to the same group. We designed a non-inferiority randomized parallel clinical trial, and the experimental group was lateral kangaroo care and control group prone kangaroo care. The experimental group, lateral kangaroo care, the babies put between the chest of the father chest in upright position, but in lateral position, inside lying, and the arm and leg bent to midline. Like you can see in the picture, the prone position is between the mother or father chest with lateral head and with arm and leg bent to midline. All babies were inside the polyethylene bag to minimize the risk of hypothermia. This study was conducted at NICU in this hospital, Hospital Universitario 12 de Octubre. This NICU is level 3C, and we have 19 beds, 9 in single family room, and 8 beds in open bay. Infants were eligible if they were born under 28 of gestational weeks during their first 5 days of life. The exclusion criteria you can see in this slide, and the removal criteria was a kangaroo care duration under 60 minutes. The sample size was calculated with this parameter, and we needed 70 subjects, 35 in each group. When the extremely infant cardiorespiratory stable, or we will say regulated like told Niels Bergman, and one of the parents stayed at the NICU, the patient was randomized. Group allocation were maintained along their first 5 days of life when kangaroo care was performed. In relation to data collection, first we check wearables at 10 minutes before beginning kangaroo care when the baby stays in incubator. Then the transfer was done by mother or father or the nurse, and the kangaroo care began. During kangaroo care, we assist the wearable at 15, 30, 70 minutes, and if the duration of kangaroo care was longer than 60 minutes, it was assisted every 60 minutes. Finally, after the transfer back to incubator, data was taken at 30 minutes after finishes kangaroo care. The primary outcome was infant accurate temperature at 60 minutes in the first kangaroo care session. The accurate temperature was continuous measured with the temperature probe fixed for giraffe, like you see in this graphic. The second variable was ABH, intraventricular hemorrhage, assisted by cranial ultrasound. Ultrasound was made at 2 different times. The first, before the first kangaroo care session, and it's made by a specialist in neonatology with a specific training in neonatal ultrasound under early ABH screening. And the second ultrasound at 48 hours of life by a specialist in royal diagnostic. This is the other variables secondary. The statistical method was this, and this study was approved by Research Ethics Committee of the Hospital 12 de Octubre. The result, this is the flow chart of the participant. The requirement took place between May 2019 and November 2021. A total of 105 infants were assessed for eligibility. 35 were excluded and 60 were enrolled. All premature infants received the allocation intervention. 35 premature infants were allocated in experimental group and 35 in control group. During their 5 days of life, the follow-up of 3 kangaroo care sessions was lost in each group. Like you can see, there were no difference in the baseline and clinical characteristics between the group. In both groups, the gestational age is similar, 26 weeks, and the weight is around 850 grams. The initiation time of first kangaroo care session was taken before the first 2 days of life, a 35 hours of life in the lateral group and 31 hours of life in prone group. And 37% the babies had the first kangaroo care session in the first day of life. Also, you can see the duration of the first kangaroo care session was higher than 2 hours. In both groups, the mother carried out the session in 82.90% at the time. In this grid cohort by linear, so initiation time of kangaroo care in extremely preterm at 88 hours of life, and only 5% preterm infant had a kangaroo care session in the first day of life. In the descriptive study of Carson, so initiation time of kangaroo care at 5 days alive, and a mean of duration of this session, 95 minutes. During the study, the first 5 days of life, During the study, the first 5 days of life, we're recording 285 sessions of kangaroo care. the median of session in lateral group was 4, and in prone group also 4. In all sessions, the participant had vascular catheter. In around 60% had umbilical catheter, and maybe near 60% had EPIC. Non-accidental catheter removal has been found during the study, neither the transfer or kangaroo care. These results are similar to the study by Nation and Sawi, which shows not influence the incidence of mechanical and infection complication umbilical catheter during kangaroo care. In other hand, in this graphic, you can see that we only 16 sessions the infants were intubated. We had 2 accidental intubations, 1 in each group. So the kangaroo care is safe in preterm with vascular device and intubated. However, it still stands as a barrier to kangaroo care, as this study saw. I hope you are still with me, because this slide is the most important one. In this graphic, you can see the actual temperature during the first kangaroo care session in the different moments where we made data collection. This is 10 minutes prior the kangaroo care, when beginning the kangaroo care at 15, 30, and 60 minutes, and when finishes the kangaroo care at 30 minutes. The red line represents the mean of the temperature in lateral group, and the blue line is prone position group. The non-inferiority analysis shows that the axillary temperature at 60 minutes to begin kangaroo care is not inferiority in lateral group than prone group. It's almost the same, 36.7 degrees. You can see that the normothermia was kept in both groups, but the transfer to come back to incubator decreased 0.2. We didn't find a statistical difference between the group intubatable related to temperature like room temperature, humidified room, or axillary temperature of the kangaroo care provider. Well, in the top of this slide, you can see the axillary temperature parameter in our study, and I'm going to explain with the next study describe the thermal control during early or late kangaroo care, but only in extremely preterm infant. In the left, Lauren et al. In 2017 show normothermia during of the kangaroo care and not different with incubator, but the subject had 29 gestational weeks. And the study of Carlson et al. In 2012 evaluate infant thermal balance and the physiological environment in extremely premature infant during skin to skin. They found they improved 0.2 degree during skin to skin. But you can see in the table that in both cases, in incubator and in kangaroo care, the temperature is lower than 36.5. Lonsky et al. In 2020 evaluates physiological stability during skin to skin and incubator on infant under 32 weeks who receive respiratory support. They found to increase skin temperature at 0.3 degree. Also, the sample size is short, and the subject had 17 days of life when he carried out the first session kangaroo care. And finally, Mastrup in 2010 showed no significant difference in mean skin temperature before, during, and after skin to skin. Physiological variables, you mean in this table at 60 minutes to begin the first kangaroo care session, is similar in both groups. you can see the heart rate in kangaroo lateral position is 152 BPM, and in prone position 153 BPM. We found more events of apnea in prone position than lateral position. And finally, respect to developed ABH, ABH event was defined as any grade of it found during the screening ultrasound at 48 hours of life, when there was none on the previous one, which was done before the first kangaroo care session. In this table, you can see that we found 7 events of ABH in prone group and 2 events of ABH in lateral group. All events of ABH are grade 1 or 2, no severe ABH. But that difference isn't statistically significant, but it might be to the sample size. Although there are controversies in the evidence, and we being conservative in our department, we are implementing a protocol ABH preventing, including the head may be placed in midline position in supine for at least the first 72 hours life. The incubator inclined 15 to 30 degrees. The extremely preterm doing kangaroo care in lateral position during the first 7 days of life. And finally, minimal handling and 2-person care. To conclusion, extremely preterm infants keep normothermia during the kangaroo care in their first days of life. The kangaroo care is safe with vascular device and intubated. The premature infant and the 28 weeks are eligible for early kangaroo care, and the lateral kangaroo position is effective and safe, being an alternative to prone position. And there are more ABH even in prone kangaroo care than lateral kangaroo care, all of them grade 1 or 2. This is Kangulat team. Her name is Ana Serrano, Patricia Martinez, Patricia Melchor, Amalia Fernández, Lucía Jiménez, Salvador Piris, y Belén Campos. And this is some of my colleagues. Thank you, all of them, and thank you so much.